I'm Abimbola Bosede Fasoranti from Nigeria. I'm presenting attitude of adults towards HIV screening, a case study of Isuada community Owo, Ondo State, Nigeria. The summary of my presentation. This is a study on attitude of adults towards HIV screening. The study was carried out in Isuada community Owo, Ondo State, Nigeria. The deadly nature of this disease and late presentation of clients to the hospital despite the advocacy and awareness created through the media prompted the researcher to carry out this research. The objectives were to examine the knowledge of people about HIV screening. Second, to investigate possible barriers to accepting HIV screening and correct negative notion about this investigation. Data was obtained through a structured questionnaire administered to adult respondents using multi-stage random sampling. My sample size was 100. Data were analyzed by the use of statistical tools and same presented in tables and charts. Chi-square and correlation coefficients were used to test hypotheses. My summary continued. The finding of study shows that 94% of the respondents were aware of this deadly disease. Then 85% were aware of the screening being carried out to diagnose it. 37% of the respondents have been screened before. Among those that have been screened were female, constitute higher percentage. 55.6% of those yet to be screened. This suggests that there was poor utilization of government hospital by the female. The majority of those that were yet to be screened claimed not to have heard about HIV screening, and they were 23.82%. 22.22% of the respondents do not see any need to be screened for HIV. My research questions. Which gender accepts HIV screening most? How many of the respondents have been screened for HIV before? How much do they know about HIV? What are the possible barriers to accepting HIV screening? Does education have effect on acceptance of HIV screening? I have three hypotheses. Number one, formal education is relatively related to positive disposition towards HIV screening exercise. Second one, previous awareness is related to positive disposition to HIV screening. The third, age of subject is related to awareness of HIV screening. The significance of the study. The study focused on enlightening the public on the causes of HIV/AIDS and identifying the groups at risk with the aim of helping them to develop health-seeking behavior. It further seeks to examine the attitude of Isuada community towards HIV screening exercise with a view to ascertain the group that is most acceptable to the exercise. It also helped the researcher to assess the knowledge of the populace about HIV, the acceptability of screening among people, as well as the barriers to accepting the screening for HIV. It will also create an avenue for further research on the topic and as well serve as an eye-opener for health workers and contribute to the pool of knowledge available on this subject matter. Research methodology. This research is an non-experimental descriptive study on the attitude of adults towards HIV screening. The research study was carried out in Isuada community, Isuada. Isuada community is located in our local government in Ondo State, Nigeria. My target population are adults, both male and female. 100 subjects were accidentally selected, males and female of various socio-economic backgrounds. And this subject was selected using multi-stage random sampling method. Result and discussion of my findings. Majority of the respondents are within the age range of 20 to 39 years. They make up of 39% of the whole respondents, and ages 40 to 59, that is 30% of my respondents. This shows that my respondents were sexually active. They are in sexually active age group. This corroborates the study by Neji et al. 2011, which reveals that people aged 50 years and older have lower level of HIV-related knowledge and awareness than those aged 25 to 49. Older adults were less likely to have been tested for HIV. Many of the respondents have basic education background. 41% had at least secondary education. 94% of the respondents have heard about HIV before through various mass media, of which radio, television make up 66.8%. This shows that even the farmers still have access to mass media, and language is not a barrier. According to O'Mary 2007, the role of media should be emphasized, as it appears that people get most of the information about HIV and AIDS and voluntary counseling and testing through mass media. Majority, 96% of these respondents, knew that HIV can be transmitted from one person to the other. A large proportion, 75% of the respondents, knew where to get tested, especially federal hospitals. But only a few, 37% of them, ever had HIV tests done for them. Of those who ever used voluntary counseling and testing services, 54.1% were male. This is as a result of screening done by them prior blood donation when their relations needed blood transfusion. This is in support of Henry J. et al. 2004. HIV testing is mandatory in the US in certain cases, including for blood and organ donors, military applicants and active duty personnel, federal and state prison inmates under certain circumstances, and newborns in some states. They are all tested. 55.6% of respondents that were screened were females. This could be as a result of poor utilization of government hospitals, as most of the women either deliver at home or are traditional birth attendants. According to Cancer Family Foundation, 4 states in the US, Texas, Michigan, Tennessee, and Arkansas, require the testing of pregnant women unless they refused. Of those who never use voluntary counseling and testing services, 23.85% do not know where to get tested, and 22.2% said they don't see the need for it. Neji J. et al. 2009 said that home-based voluntary counseling and testing is a means of improving access, while simultaneous stigma associated with HBV generally involve the use of lay counselors, or community health workers who provide door-to-door counseling and testing services. My conclusion. Conclusively, the study has demonstrated the acceptance of HIV screening among adults in Isuada community, Owo. The community health centers and our traditional birth attendants should not be left out in their involvement in HIV screening so that everyone will know their status and commence treatment as needs be. Thirdly, poverty is one of the hindrances to screening. The government should introduce free HIV screening to all levels in healthcare system. My recommendation: the government should introduce free screening exercise to people in the community so that there will be free access to screening. Secondly, training of traditional birth attendants on importance of HIV screening and the procedure should be done by our government. Our health workers and social workers should be encouraged to work in the community so that the less privileged and the illiterate will have access to health care services. My references. My first important reference, Federal Ministry of Health of Nigeria, 2006. The 2005 National HIV Seroprevalence Sentinel Survey among pregnant women attending antenatal clinics in Nigeria. The second one is Joint United Nations Program on HIV/AIDS, UNITE, AIDS Epidemic Update, December 2007. Then Mary Sukari, 2007. Barrier and Attitude Towards HIV, Voluntary Counseling and Testing. It's a research from Nwasa. The Negi J. Cummings, RG, HIV infection in older adults in sub-Saharan Africa. Then my fifth important reference is revised recommendation for HIV screening of pregnant women. That's the end of my
Thank
presentation.
you.
Thank you.